And the Mobile Health Summit kicked off today in Washington, D.C., and over the next 3 days, over a series of panel discussions and exhibitors, this conference will explore and showcase how wireless technology can help improve health outcomes in the United States and in developing countries.
Totally embrace it. We have to be.
This is the second year that the Foundation for the National Institutes of Health, in partnership with the mHealth Alliance, produced this summit, creating a forum for leaders from the research, policy, business, and development communities to explore the use of wireless technology to improve health.
Well, what we want to do is basically bring all the players together. We want to bring government, we want to bring private sector, we want to bring academia, and certainly the nonprofits together and talk about this issue of mHealth. It's absolutely important. It's something that's penetrated certainly the developing countries, and I think that may be the place that's probably even more important than here in the U.S.
We hope to bring together a wide variety of partners in a broad coalition to implement mHealth in support of achieving the Millennium Development Goals, in particular for women and children's health, trying to develop and deploy modern systems, information systems supporting frontline health workers.
Those are some of the panel discussions taking place at this year's convention, where experts are sharing their perspective on the pros and cons of using mobile phones to advance the healthcare sector, especially in places like India, where millions of people lack proper health care.
There's a tremendous opportunity. 675 million people with mobile phones. 80% of Indian population do not have access to proper health care, and most of them have mobile phones. Now, coming to challenges, one is lack of awareness among all the stakeholders, which I think is very important. And two, at the end of the day, it has to be revenue generating, self-sustaining.
In East Africa, the government of Tanzania has also integrated a mobile health initiative to address the issue of medical data collection.
mHealth now is, as we have said, is still in its initial stages, but we have managed to reach the remote areas, very remote areas, and currently the study is still in Urambo district, and it's in its initial stages, but it has had a massive impact.
This is precisely the type of technology that companies are producing in the U.S., and here at the summit, dozens of exhibitors are showcasing the latest devices available to help healthcare providers and patients.
Actually, Verizon has now started to partner with companies like CellTrak in making sure that the applications being able to be given to those field staff, so when they go to visit the patient's home, they can actually get information from the point of care back to the offices so they can actually make sure they're giving the best outcomes for those patients.
Besides mobile phones, attendees will also see the latest portable scans, software solutions to detect physical activity, practical medical tools monitoring blood pressure, weight, and diabetes, as well as other groundbreaking mHealth technology. According to Rafael Anta, lead specialist at the Inter-American Development Bank, the private sector is committed to helping advance this initiative of using wireless technology as a tool for development.
We're in the conversation, the discussion with policymakers about introducing more technology in public health, because otherwise it's impossible to provide customer health care on a cost-benefit equilibrium.
An undertaking that representatives from the non-for-profits welcome as mobile health continues to evolve.
From a non-profit perspective, you need to first focus on how to develop integrated models that can respond to these health needs. And that's not an easy task, especially if you're targeting communities that are not equal in characteristics, socioeconomic status, access, connectivity, etc. So I think our perspective is that mHealth is going to succeed, but you need to take it to a step further, in a sense that you need to demonstrate success.
And tomorrow, the dialogue and exchange will continue. Two very important philanthropists, Ted Turner, chairman of the United Nations Foundation, and Bill Gates, co-chair and trustee of the Bill and Melinda Gates Foundation, will be present as keynote speakers addressing the issue of global health. For South News, I'm Mildred Espinosa, Washington, D.C.